Hi, my name is Theriyana and today I'm going to be doing my medication administration checkoff. So first I'm going to scan the room. I'm going to show you my badge. I'm a nursing student here at the University of South Alabama, and because I'm in a hospital environment, I'm going to make sure I'm in a no interruption zone and make sure I'm abiding by that policy, which means that my conversation with colleagues will be to a minimum, only getting important information if needed. I won't be answering my phone or texting, and all doors will be closed and shut. So I'm going to perform hand hygiene. I'm going to go over to my medication administration record and my patient care order form, and I'm going to do my first check of accuracy, which are my 7 rights. So I'm going to do right patient, Jaguar J. Jones, Jaguar J. Jones, right medication, which is Novolin R U100 insulin, Novolin R U100 insulin, the right dose, which is 10 units, the right route, which is subcutaneously, the right time, which is 30 minutes before meals, and the right documentation and indication will be done towards the end. He is allergic to penicillin. So now that I'm done with my first check of accuracy, I'm going to wash my hands. I'm going to head over to my medications. So it is the right time, which is 30 minutes before Mr. Jones's meal. I'm going to make sure that I'm picking the right medication, which is Novolin R U100, Novolin R U100. Grab a Novolin R. And it is not expired, so we're going to go ahead and use this vial today. The route is subcutaneous, which means I can go at 45 or 90-degree angles when injecting, but it depends on the patient. And since I'm administering a form of insulin, I'm going to use an insulin syringe. So let me show you the syringe. Okay, it's already removed from the package, so that's fine. I'm going to clean with the alcohol prep pad on my vial. So because I'm administering 10 units of Novolin, I'm going to draw back 10 units of air. So I'm going to remove the top and draw back 10 units of air. I'm going to show you guys that I have 10 units. Okay. So once I have my 10 units of air, I'm going to insert this into the Novolin vial, push down. So now I'm going to push that air back into the the vial, excuse me. I'm going to draw back 10 units of Novolin. I'm going to do the scoop method to get my needle back in. I'm going to verify with another nurse that I did draw 10 units of insulin, of my Novolin, and then I'm going to show you guys that I did 10 units. Okay, I'm going to do my second check of accuracy, which will be my 7 rights once again. So I'm going to do the vial as well as the insulin. Before I do my insulin syringe, I'm going to make sure that I have a label for it. So I'm going to do the patient, which is Jaguar J. Jones. I am going to do the right medication, which is Novolin R U100, And I'm going to do the amount of medication that I'm going to do. So it's 10 units, which would be the dosage. 10 units, and I drew up 10 units. So I'm going to put this on my label. So now I'm going to start my second check of accuracy. Right patient, Jaguar J. Jones. Right medication, Novolin R U100 insulin. We got my Novolin right here. We have it in the syringe. We're going to do the right units, which is 10 units. It's going to be administered subcutaneously, so that's the route. The time is 30 minutes before his meal. And documentation and indication, we're going to do that towards the end. He's allergic to penicillin. So once I'm done with my second check of accuracy, I will then move to the patient's room. Perform hand hygiene, knock on the door. Hey, Mr. Jones, I'm Theriyana. I'm a nursing student here at the University of South Alabama. I'm going to start off by doing 2 patient identifiers. So I'm going to do the name, which is the patient, Jaguar J. Jones. The date of birth, which is 08/25/1963, 08/25/1963. The MR number is 417-6352, 417-6352. I'm going to check his allergies. He's going to be allergic to penicillin. Then I'm going to ask him if he has any more allergies that I don't know about. And if he doesn't, I'm going to move on. Then, depending on the medication, I would take vital signs such as blood pressure or check his pulse. So, now that I have done that, I am going to go over to Mr. Jones's bed. I'm going to raise the bed to a working height, which will be about waist level. I'm going to lower the side rail, and then I am going to perform hand hygiene and don my not sterile gloves, but clean gloves. And I'm also going to don my goggles after my gloves. After I have on my goggles, I'm going to do my third and final check of accuracy. So I'm going to take my vial as well as the syringe and compare it with my 7 rights for a third time. So I'm going to make sure I have the right patient, Jaguar J. Jones. The right medication will be Novolin R U100, Novolin R U100. The right dose, which is 10 units drawn up in my syringe, is going to be administered subcutaneously. The time is 30 minutes before his meal. Documentation and indication, we're going to take care of that at the end. And allergic to penicillin, and he didn't notify me of any other allergies, so we're good. So that was my third check of accuracy. So I'm going to come over to Mr. Jones. I'm going to pull back the linens, only revealing the injection site. So I'm going to inject this Novolin subcutaneously. So that's going to be 3 fingers below the acromion process and 3 fingers above the deltoid indention. So we're going to insert it in that little square space that you see right there. I'm also going to assess the skin to see if there's any cuts, scars, lesions, rashes, or anything that would interfere with the injection today. So once I see that his skin integrity is good, I will then grab my alcohol prep pad and clean the injection site. And his injection site is going to be dorsolaterally. Forgot to mention that. Okay, I'm going to keep my alcohol prep pad right there. Then I will grab my insulin syringe, make sure that it's Novolin U100 regular insulin. Remove the cap. I will then pinch the skin and administer at a 90-degree angle. You can go 90 or 45, but today I'm going to do 90. And I'm going to stick into the patient's skin and administer it for like 5 seconds. All right. I'm going to put this in my sharps container. I'm going to clean with the alcohol pad. All right, and if I have any other trash, I'm going to dispose of it in the trash can, and any other sharps I will put in the sharps container. So I will then reposition Mr. Jones, make sure that he's good and comfortable. I will cover him back up. I will lower the bed back down and lift the side rails. And then I would make sure that he's not having an allergic reaction to the injection as well. So after I've done all that, I would then doff my gloves and my goggles. So we're gonna go glove to glove, skin to skin. I'm gonna take off my goggles. I'm going to come over to my medication. Well, before I touch my medication administration record, hand hygiene. So I'm going to come over to my medication administration record, and I'm going to document how Mr. Jones took the procedure, if he had any allergic reactions or any allergies that were not listed on here. I will also check to see if he had any reactions to the insulin, or if I had to give him any pain medicine. Then I will come back a little later in the day to see again the injection site and if he had an allergic reaction. And I'm finished. Thank you.